Hi everyone, this is Dr. Praveen Patil here. So today I am going to talk about the hemorrhoids. I welcome you all to my channel called SkillAyurveda. So actually a God has made us, means our body, to walk in this fashion. So using all our limbs. But on the period of the evolution, so our position kept on changing. So later on we started using only two limbs, that is lower limbs we have started. So this is hemorrhoids are nothing but the penalty what we are paying for our erect position. I repeat, this is a penalty what we are paying for our erect position. Because of the gravity or because of our erect position, the veins become engorged in the anal region. Those are called as hemorrhoids. The hemorrhoids are also called as piles. So today we will discuss what are actually the hemorrhoids and what are the classification of that, and what is the presentation, and what is the possible treatments available at now. So before entering into the hemorrhoids, so this is the cross section of the rectum and anal region. Blood supply to the rectum and anal canal is in the form of artery as usual to the other organs, and one which takes the blood away from the anorectal region, that is in the form of veins. So here the thing we need to understand is there are different veins which are draining the anorectal region. So any kind of cushion failures that leads into formation of the hemorrhoids. Hemorrhoids are nothing but a engorgement of the hemorrhoidal plexus. Here there is veins, and as I told, this is just a cushion failure, is a submucosal layer. These veins become engorged. So if the veins become engorged at this area, these are called as internal piles, and if these hemorrhoidal plexus get engorged, then these are called as external hemorrhoids. I repeat, this is the internal hemorrhoid and this is the external hemorrhoid. The veins get engorged, dilated, so that is called as piles. And sometimes this internal hemorrhoids engorgement accompany with the engorgement of the external hemorrhoids, that is called as interno-external hemorrhoids. Then what is the cause for this? When we look into the causes, one is hereditary. First one is hereditary. We can say exciting causes like constipation, and diet, like the diets which are causing the constipation or hardening of the stool. So where the person need to put more pressure to expel the stool out. In those conditions, there will be a pressure which is exerted on the hemorrhoidal plexus that may cause the engorgement. So even times if the stool persists for longer time here, so it will put a pressure on the veins. venous return. So what happens? The veins runs in the muscular layer. So whenever there is a stool here, okay, so this stool put a pressure on the vein. It will put the pressure on the vein, on the wall, and next into the vein. So this pressure will cause a dilatation because of the back pressure developed. So this dilatation or engorgement is called as hemorrhoids. So this is how the constipation also become a cause for the development of the hemorrhoids. And I told a physiological causes also. So another next cause is physiological, means because of the erect position. So there is could be a chances of developing a engorgement in the veins leads into hemorrhoids. So I repeat, hereditary causes, exciting causes like constipation and all, and diet, which is, so that's why in the most of the hemorrhoidal cases we recommend a fiber rich diet to avoid the constipation. And physiological causes, as I told earlier, this is a penalty what the human beings are paying for his erect position. So these are the primary causes. Primary means where the hemorrhoids is the prime disease. So when you look into the secondary causes, so like any kind of disease which in putting a pressure on the hemorrhoidal plexus like cancer and portal hypertension. So this could be a secondary cause. So where the hemorrhoid is not a primary disease. So primary disease like cancer or portal hypertension, which will cause a back pressure on the hemorrhoidal plexus, which leads into formation of the piles. So as I told earlier, so one is internal hemorrhoid, second one is external hemorrhoids, and sometimes all both together exist. Those is called as internal external hemorrhoids. So internal hemorrhoids is further classified into 4 stages. If there is only a engorgement is there, that is a first degree hemorrhoid. If this is coming out from the anal verge and it get reduced by itself at the time of defecation, it comes out, and soon after the patient changes his position, it will move back into the anal canal, that is stage 2. If it comes out and at the time of defecation or at the time of urging, at the time of exciting, so when it needs a manual repositioning, so that is called as stage 3. And when it comes out and sometimes it may become difficult to reposition it, so that is called as stage 4. So this is another kind of what we can say is a staging or classification of the internal hemorrhoids. When you take a patient in the lithotomy position, actually the anal canal looks like this, like a oval shape, but we take it into the round shape. So lithotomy position, and if you imagine a clock position, so this comes 12 o'clock, 6 o'clock, 3 o'clock and 9 o'clock. So the common places for the hemorrhoidal development is at 3, 11 and 7. So 3 o'clock, 11 o'clock and 7 o'clock are the common positions for development of the internal hemorrhoids. 7, 3, and 11. Coming back into the clinical features, bleeding is a prime feature and sometimes prolapse of the hemorrhoids. So in the second degree, third degree and fourth degree, the patient may complain of lump in the anal region, and pain if the usually seen in third degree and fourth degree of hemorrhoids, and mucosal discharge sometimes seen, and sometimes patient may land up with thrombosis of the hemorrhoids. So when you look into the treatment options, so in this video I am not going to discuss in depth about the treatment options. So in the first degree and second degree we can use the injection therapy, that is sclerogen injection therapy, and sometimes they use the cryosurgery, and the commonly used surgical procedure is Milligan and Morgan hemorrhoidectomy, that is the invasive procedure, and nowadays we can use a closed hemorrhoidectomy or else a circular stapler hemorrhoidectomy. So this is about the brief introduction about the hemorrhoids. So if you find this a worth value of spending a time in with me, then kindly subscribe to the channel and forward my video. Thank you. Thanks for watching.